Welcome to Science with Soul. I'm Dr. Lotte Valentin and the host of this program. I'm a physician, Evidential Psychic Medium, international keynote speaker, and the author of Med School After Menopause, The Journey of My Soul. This podcast was inspired by events from my own life, and as I have journeyed through life, it has taught me that we're part of a greater divine web of interconnectedness. I have walked the path of illness, healing, and transformation, and after experiencing 2 near-death experiences, I became clairvoyant, clairaudient, and clairsentient, and I was guided to attend medical school at the age of 54. In this podcast, we will meet many different types of doctors, healers, spiritual leaders, educators, and other interesting souls. And it is my hope that you will gain information from this podcast to help create a path of healing your own life physically, emotionally, and spiritually, and bridge the gap between science and soul. Welcome to Dr. Lotte's Science with Soul. I'm Dr. Lotte and the host of this podcast. Today, I am very excited to have Kate Boyce with me. She most likely knows way more about endometriosis than most physicians were taught in medical school. Endometriosis and adenomyosis are conditions that are often misdiagnosed and mistreated due to the fact that most physicians lack a deep knowledge about these diseases. After nearly 15 years of debilitating menstrual and autoimmune disease symptoms, Kate was surgically diagnosed with endometriosis in 2013. Then it would take another 4 years to find an expert in excision of endometriosis and receive a hysterectomy for suspected adenomyosis. Her journey has been filled with nearly 2 decades of working with specialists and navigating the healthcare system, both allopathic and naturopathic, as well as navigating mental illness and alcoholism. She is now a board-certified patient advocate dedicated to proper education about endometriosis and adenomyosis while assisting patients in finding their expert care. So welcome, Kate. I am so happy you will share your knowledge with the listeners today.
Thank you so much for having me. I'm so grateful.
So tell the listeners, what were your initial symptoms and at what age did they begin?
So my symptoms started quite young. I was approximately 7 years old when I first started experiencing my gastrointestinal symptoms. Those were my very first ones. It kind of coincided with early puberty. I had started to develop breast tissue during that time, yet that I hadn't started my period yet. That's when my symptoms definitely started to arise. I remember I was already missing school, and we were already trying to figure out why I was having such awful bowel pain. And so that was definitely the first thing that happened. And then as time went on, and I did begin menstruating at the age of 10, they weren't really initially very painful, but I was starting to have more of inflammatory symptoms throughout my entire body. So I kind of started noticing that I was having joint pains, and I was feeling extraordinarily lethargic. There were multiple times where I would have, doctors tell me, well, maybe you have this, maybe you have that. By the time I was 15, I was being regularly checked for various autoimmune diseases, including lupus. My test would always come back normal, but they assured me that just because my tests were normal, that they wouldn't necessarily rule out those autoimmune diseases as a potential cause for my symptoms. Unfortunately, as time went on, my menstrual pain did become unbearable. So it was kind of this interesting thing where it definitely progressed, and it wasn't initially just menstrual pain. So by the time I was 15 is when they really became unbearable. And it's hard because I reflect back on some of these times where, I've been in therapy for a long time, and sometimes I know when it's appropriate and when it's not appropriate to look back on certain things. But I know in these cases, it's really important for me to reflect on, because I can share more authentically about my story when I go into it. I sometimes like to get just into the educational part, but it's important to remember my story as well.
Yes.
And I am very fortunate that I have an older sister who also had experienced the exact same symptoms as me. She's 8 years older, but also went undiagnosed. So she kind of coached me. And I essentially lived on naproxen, Aleve, to manage my pain, all of my pain, my joint pain, my menstrual pain. And I was on a prescription for a while that really helped, Vioxx. It eventually was pulled by the FDA. That was really traumatic for me at the time, because I was not ready to try hormonal suppression for my symptoms. I was 16. However, I decided that by the time I was 17, it was time to try birth control to manage my menstrual pain. Unironically, every single type that I tried didn't work. Every OBGYN just says, oh, we just got to keep trying different pills. You'll find the one that works for you. All it did was make all of my symptoms worse. My joint pain was unbearable, and I actually had my first episodes of tachycardia. I ended up having to wear a heart monitor while they tried to figure out why my heart was acting the way it was, and they insisted that there was no way it was the birth control. I eventually came off the birth control, and all of those symptoms did subside. And basically all they had told me was that you have supraventricular tachycardia and try to avoid caffeine.
Wow. I'm sure you've heard many stories like this by now. Now that you work as a patient advocate. How did you feel about that when they told you, oh no, it can't be? How do you cope with that mentally? What's the mental and physical toll of having, the symptoms with no definite diagnosis?
Right. It was horrible. Because I truly thought it was in my head. And then they would try to say, well, maybe it is lupus, maybe it is autoimmune. So I'd go home, and I was 17 and 18 years old at this point, Googling and terrified.
Yeah.
Nobody had answers for me, and I was starting to feel really crazy in the head.
Yeah.
And then my interpersonal relationships also became pretty distorted and eventually destroyed because of it. I was often seen as like neurotic, making up different symptoms for attention. And I found it really hard to relate with anybody, and we could never manage my pain, and my pain was getting worse over time.
Did you just have pain on your cycle, or did you have abdominal pain all the time, or it comes and goes?
I had almost constant systemic inflammation and pain from that. So like my joints were always hurting. It was hard for me to do any kind of like sport. It was really difficult for me. It was a lot of gastrointestinal issues. I tried to eat as healthy as possible, but my bowel movements were really painful, and you kind of hear this classic like stabbing and burning through your entire abdominal and pelvic cavity. And that's a lot of what I had. I didn't realize until much later that you could live a life without feeling that.
Yeah.
And the pain, it's hard to pinpoint it because it is all over and you feel it always. And then just, and then I would get particular symptoms leading up to my period. Mostly, a lot of that endo belly we talk about. And then,
explain that to the listeners that don't know what endo belly is.
Endo belly is like this thing it's such a common manifestation that we have a little cute nickname for it now. It's one of the only physical things that we can show with this disease is the abnormal, like inflation of our lower abdomen. It just gets rock hard, and it will look like you're 4 or 5 months pregnant. And it's extraordinarily painful. A lot of us will tell you it's actually hot to the touch. And all you can do is wear pants that don't have any like pressure that will apply to it. Mm-hmm. It's incredibly painful.
Yeah. Did you think that it was from eating the wrong foods, or did you know that it was something else? Like, for people that have that symptom now, what would be your advice?
You know, for me, one of the ways I tried to manage was extreme diets. And I noticed that no matter what I did, I noticed, you know, sometimes if I would avoid certain inflammatory foods, it would get better. But ultimately, nothing I did could truly prevent it from happening. And I started relating it to my period because it would I started tracking my symptoms more closely. And I started seeing it in the cyclic nature. So other than, you know, trying to do those diets to manage, I actually ended up managing my pain with alcohol because I could not tolerate hormonal suppression on birth control. So that began my journey with alcohol. It helped me feel more normal around my friends. Mm-hmm. I was able to participate with them. I was able to relax. It dulled the pain to the point where I wasn't only thinking about it and talking about it. So that began my journey with alcoholism as well.
Mm-hmm. Yeah, because you really there was nothing else that they could do. You tried the birth control, it didn't work, and not getting an accurate diagnosis. What eventually led to the decision of having a laparoscopic procedure done to look for endometriosis?
As I got older, my symptoms progressively did get worse. Primarily my menstrual symptoms and the cramping and the bowel movements. And interestingly enough, you know, that's all very interconnected. And when you look at the anatomy, the female anatomy, you look inside there, you can see just how close all of those organs really are. And it eventually began to make more sense to me, especially once I saw surgical pictures. But my first episode of going into shock and passing out and losing control of my bowels at the same time on the floor of my grandparents' bathroom was when I finally drew the line and I said, this is not right. I will never forget my grandpa driving me to the emergency room, and I was just counting the breaths I could get in between the pain as it would come over me in waves. And I was taken in a wheelchair, and I was there for hours, and they could not get my pain under control, even with multiple injections of opioids. And, you know, they did all their quote normal testing and everything appeared normal. And, you know, of course, when I first came in, they thought maybe it was an ovarian torsion, but they ruled that out, and my blood work was fine, and my ultrasounds were fine, and my transvaginal ultrasound was fine. So they released me and told me to follow up with an OBGYN. And that was such a traumatic moment for me that I said, I'm doing something about this finally. And that was when I drew the line there at that moment to get a diagnosis.
And so they did all these transvaginal ultrasound and lab work, and then they told you everything was normal. And do you find that this is a common problem with endometriosis, and why is it that way?
Yeah, it's incredibly common. And it's very sad. And that's another, big factor into why a lot of us start to believe that it's just in our head. Unfortunately, endometriosis can't always be picked up with imaging. There are certain forms of endometriosis, namely deeply infiltrating endometriosis, that can be seen with certain imaging. Technology is always getting better. But the unfortunate reality is that if you go to the emergency room, they're not going to have the technology or knowledge to know exactly what to look for. And more often than not, you end up in a situation like I was in when we get sent home.
And then you had the laparoscopic procedure done. And how old were you then when they found it? Or did they find it?
They did.
Mm-hmm.
I was in my early 20s. I tried. I can't exactly remember how old I was.
Right.
But I was in my early 20s, and it was actually it was a primary care physician who helped me get the laparoscopic surgery done. When I had followed up with an OBGYN, mine had left. So they said, oh, you'll follow up with Dr. So-and-so. He's really great. And he told me there was nothing wrong. And he tried to prescribe me Linzess for my gastrointestinal issues. He told me that I had gone into shock because of a vasoreaction in my intestinal tract. And I was so confused by that, but he pushed it, and I said, I don't want to do those things. And he said, then I can't help you. And he walked out and left the door open. So,
Well, yeah, I hear a lot of stories like that.
Mm-hmm.
It's sad, the misdiagnosis that keeps happening over and over.
Yep.
So then, what was your approach to managing the endometriosis after diagnosis, and what made you realize you needed to find that expert care?
So after, I had the typical month or two of relief that some of us get, I was put on the mini pill, which is a low dose of progesterone only. Did not work. So I decided to work with a naturopathic doctor at that point. And I thought that we could really, make some changes with my menstrual cycle. Because at this point, I'm not very educated in endometriosis. I just know that, okay, I had a surgery done. This doctor found 3 spots of it. And it looks like maybe I can fix my menstrual cycle and I'll be okay. So I work with this wonderful doctor. She's very kind, very sweet. But unfortunately for me, my disease was so out of control that no matter what we did, my monthly cycles just kept getting worse. So I remember during that time, I felt really good. I remember so many other parts of my body were so vibrant. My hair was so healthy, my skin was great, all of the things to show that you're doing what's right for your body. So what I was doing with her and the supplements I was on and the various different techniques she had me doing were working for everything except my endometriosis. And that was a really hard reality to face. I had quit drinking alcohol during that time. And when I came to the realization that it wasn't working, I started drinking again, which does make it worse when you finally are sober. So I started just drinking all of the time. So I didn't have to be sober and feel any pain. And I was in school, and I did eventually say, I've got a lot going on mentally. I do need to get sober. Maybe this will help me. I'm going through all these different things trying to find ways to help. And so it was Christmas. I was in Arizona with my family, and my mother had just had eye surgery. My stepfather had injured his shoulder, and I was in my bedroom, and all of a sudden I thought I had food poisoning. I had this very familiar cramping that started to happen, and I just said, oh no, not again. And I went to the bathroom, and I sat on the toilet, and I lost my breath, and I started to pass out, and I yelled to my stepdad to please call 911, please, because I know what's about to happen. And I said, they're going to come in here. I'm probably not going to be able to talk. I need 10 micrograms of fentanyl to bring me out of this. Because at this point I knew. Mm-hmm. But this was a particularly bad episode, I could feel. So fire department shows up. They give me the fentanyl in the ambulance ride. They get me to the small doctor clinic in the desert, and my doctor comes in with a cowboy hat because it's Arizona, and he looks at me and he's like, are you okay? I said, yeah, I'll be all right. He's like, what's wrong with you? I said, well, I have endometriosis. It's not under control. And every once in a while, I have one of these episodes that just overcomes me. And he looked at me just completely confused. He said, do you want painkillers? I said, no, they don't even work. All they do is make me feel out of it. And he looked at me, he's like, are you sure you're okay? Like, do you need to follow up with someone? I said, you know what? I think I know what I'm going to do when I leave here. And, I really appreciate, the ride I was given in and getting the pain managed. And he just looked at me and said, are you ready to go home? I said, I would like to go home now. And on that ride home, I said, what just happened to me was insane. And I was like, I can't do that again. I cannot continue to live my life wondering when that next type of episode is going to hit, where I'm once again in an ambulance and once again looking at an emergency room doctor saying, okay, I want to go home now. None of that makes any sense.
No, it doesn't. It doesn't make any sense at all. And it's astounding what you have been through, and many other people that are still going through it and don't even have an accurate diagnosis yet. I know that you also had a diagnosis of adenomyosis. So when and why was adenomyosis an additional diagnosis? And can you explain to the listeners what the differences of endometriosis and adenomyosis? Because I think there's a lot of confusion about those topics out there.
There is a lot of confusion, and rightfully so. So the adenomyosis occurs when the uterine lining, which is called the endometrium, that is the layer that sheds with the menstrual cycle, that layer has infiltrated the muscle of the uterus called the myometrium. We don't for sure, know why that happens. It's commonly seen when a uterus has been undergone some kind of trauma, either repeated births, a C-section, any kind of way that would make sense for there to be mechanical infiltration of the endometrium into the uterine lining. However, we are seeing it more frequently in younger individuals that have no known, cause of trauma to the uterus. So that endometrium is actually within the muscle, and it's doing all of those things that the endometrium should do during the menstrual cycle. So it changes in shape, it changes in thickness. Unfortunately, it's doing that within the muscle, and it's causing extraordinary pain. It's in the wrong location. And there are different types of adenomyosis. It can be focal, meaning there's just like a big piece of it within the muscle, or it can be diffuse, meaning there's bits of it all spread out the uterus. Unfortunately, with adenomyosis, it can't always be seen on imaging either. More advanced stages with a very large boggy uterus can be caught. Mine, however, was not seen. Endometriosis is quite different in that endometriosis is tissue that is similar to the uterine lining, that endometrium, but it's quite different. It's very different in its histology. It's very different. When we look at it under a microscope, we can see that, okay, it has some similarities to the endometrium, but it is quite different, and it doesn't behave the same way. So for me, and for many of us, quite honestly, it's hard to differentiate between the two with our symptoms. A lot of the symptoms overlap. So with me, I was adamant I don't have adenomyosis, because everything you read online says, it's individuals who've had kids or older individuals that over time have an enlarged uterus. And I'm like, well, none of this makes any sense for me. I have some of the symptoms of it, but I didn't have the heavy bleeding that often accompanies it. And I didn't have the other risk factors. However, my sister, she actually got diagnosed at the same time I did. And she found our surgeon first, Dr. Sinevro at the Center for Endometriosis Care. And she went to him, and she knew she had adenomyosis, even though she also didn't have any of those risk factors. She said, I swear this is what we also have. So she goes and she had her excision surgery, and she opted for the hysterectomy. And sure enough, adenomyosis can be definitively diagnosed. Once the uterus has been removed and sent to pathology, they look for that endometrial tissue within the muscle of the uterus. And she did have adenomyosis. So here I am looking at my situation where my symptoms are identical to my sister's. She's 8 years older, and my progression seems to be on the same timeline as hers. It's very, very bizarre. So when I decided a few years after her to finally get to Dr. Sinerva with the Center for Endometriosis Care, my sister had put in all of this work to research the proper care. She went to him. I saw her success. And I started thinking, I was like, I want this hysterectomy. I may or may not have adenomyosis, but I want this to be the most successful surgery I can possibly have because I cannot continue to live the way that I was living. I know that decision isn't for everybody. And I know that in many ways I feel fortunate that I was okay with the hysterectomy. And so I opted for that, and pathology did confirm that I did in fact have it. But I think it's important to note that, the risk factors that we commonly read aren't necessarily accurate for all of us with endometriosis. First, we don't know why they often coexist, but they do. And another big thing for me is I like to tell people, I got adenomyosis even though I didn't have heavy bleeding.
Yeah. The endometriosis. Now, a lot of people think that endometriosis is just something that happens inside the uterus. Can you tell the listeners a little bit about where the endometriosis actually grows and, where can it end up in the body?
Yeah, so endometriosis, unfortunately, is incredibly cryptic. There's only a few places in the body that we know of it hasn't been found. I think actually the spleen is the only major organ in which it hasn't been found on or infiltrating. So we don't have any one theory yet that can fully explain why endometriosis appears where it does or why it behaves the way it does. But we now know that it's not uncommon for endometriosis to affect the bladder, for it to affect the gastrointestinal system. We're seeing more cases of diaphragmatic endometriosis. It affects the appendix quite often. So it's just, we talk about how it's not just a pelvic disease, it is an extra pelvic disease. And that's one of the reasons that it does require knowledge outside of the realm of just OBGYNs. We need other specialties and other areas of focus to truly know what to look for, because we do get silent kidney failure as one of the complications of endometriosis. My ureters were completely constricted, and I would actually get flank pain in my back from my ureters not properly functioning.
Yeah, and so is hysterectomy a cure for endometriosis? That's also a very common question that people.
No, it's not. So like I say, the hysterectomy for me was strictly for the adenomyosis symptoms. I couldn't handle the actual period itself anymore. However, some people do get relief with a hysterectomy for various reasons. However, endometriosis is not cured by a hysterectomy. And it makes sense, when you look at it as this. Endometriosis exists outside of the uterus. It exists in various parts of the body. Just removing the uterus, the organ itself, is not going to make the endometriosis elsewhere in the body disappear. And I feel like that can sometimes give a good explanation as to why a hysterectomy can't just magically make the endometriosis pain go away. And it is definitely not a definitive treatment for the disease.
Mm-hmm. And so people that, they're 12 years old, let's say, and their menstrual cycle starts and they have terrible periods, and then they go to the OBGYN and they're told, oh, it's just the beginning of your period and it's going to even out. Your pain will go away in a year or so. And if it doesn't, we can always try birth control pills. So these young teenagers or kids that aren't even teenagers yet that start their menstrual cycle, do they already have endometriosis at that age?
So the research that has been done, there's a lot of it, fortunately, where doctors have gone in and investigated pelvic pain in younger individuals. Yes, endometriosis is already there. So there's been research that has found that there were approximately, I don't remember, about 100 fetuses that were inspected for endometriosis that also had endometriosis in them already. So,
in the fetus?
In the fetus, yes.
In the fetus. So they're born, basically you're born with endometriosis. So
yeah,
your first cycle, It's already showing up.
Exactly. So there's a lot of thought that, we're born with it. It's just misplaced tissue during fetal development. As you know, as a doctor, all of our organs and our tissue stems only from a couple different places, right? And then over time, as we're developing, it essentially turns into the tissue it will be later. I'm trying to keep it in layman's terms, So what's interesting is that, the tissue and that goes on to make the uterus and the endometrium, it hasn't made it there. It's like, in a way, it's been misplaced during development. So it's just the body just kind of messing up a little bit. And then it seems that in some of us, as we begin to get hormonal changes, those cells, for some reason, decide to respond. We do know that some have progesterone receptors, some of the cells have estrogen receptors, some have both, and some have none. So there's various different types of endometriosis that can occur within one person. But we do see that, as puberty begins, like for me, I 100% fully believe I was born with endometriosis, and for whatever factors, epigenetic or genetic, my endometriosis was essentially triggered when puberty started for me at the age of 7, and it started inflaming in my bowels. So for me, that makes a lot of sense, when I look at my case. And so it is commonly seen in teens, but, teens definitely seem to also have really good outcomes when they can get to an expert, because the disease is progressive and because it is inflammatory and can cause scar tissue and adhesions over time. The ultimate goal is to catch it early before it causes permanent damage within the body.
Mm-hmm. I like that you brought up the fact that it's also progesterone receptors are found in this tissue, because many people think that it's an estrogen-driven disease, when in fact they know that progesterone receptors also exist, and you can have both estrogen and progesterone receptors in that tissue that's being biopsied. And I think that's something that's really important for people to understand, that it's a disease that is so misunderstood on so many levels, and it really goes back to what we're being taught in medical school, and we need to really reach that whole group of the new physicians that are going to medical school and train them better in this disease. You also spoke about excision surgery. What can you tell the listeners about that, and why that would be the preferred method?
So, yes, I talked about my hysterectomy for adenomyosis, but I also had excision surgery at the same time. So excision surgery, there are a few different ways in which it can be done, but essentially it is the actual removal of endometriosis tissue in those lesions by cutting, right? So there's another form of surgery that can be done that more traditional OBGYNs will do. They'll go in, they'll kind of look around, and they'll simply burn the surface of whatever lesions or abnormal tissue they find. And they send you on your way. And unfortunately, you get a really quick recurrence of pain from that because the disease hasn't been addressed. With excision, it's a meticulous surgery in which your surgeon actually is cutting out the tissue from its root rather than just cutting off the surface. So you'll see often, these little graphics showing an iceberg where the burning, the cauterizing, or what we simply call ablation of the endometriosis, that's just the removing of the top portion. Whereas excision is showing going down into the water and pulling out that entire iceberg. And that's critical with endometriosis. So I also liken it to, if you have a tumor, benign or cancerous, your oncologist is going to go in and fully remove that tumor. They're not going to leave bits behind and say, we can just clean that up by burning it. That would be considered incredible negligence. Yeah. For some reason, it's okay with endometriosis. However, endometriosis needs to be approached the exact same way. And, not everyone has the same skill in doing so. It takes a lot of time for these surgeons to know what to look for, since endometriosis can look different in every patient. Sometimes you don't even notice it until you really start to push organs around and look behind. Sometimes you don't notice it until you cut a little bit away of something that looks abnormal, and then all of a sudden, out of nowhere, a ton of it will show up. And that's why it's so important to have someone who's done enough of these surgeries. They know where to look, they know what to look for, and they know how to properly cut it out. There are different, you can use a laser to do so. There are some doctors that actually use a cold scissor technique. To each their own. We care more about the skill of the surgeon than the technique in that respect. But it's really important also to note that because endometriosis is a whole body disease, it is not just a gynecological disease. It is important that when looking for an expert to know that they work with a multidisciplinary team. So the experts do work with other specialists. So for my case, I had a colorectal surgeon on call in case I needed a bowel resection. There are, for the cases of thoracic endometriosis, there will be a cardiothoracic surgeon that will come in and work alongside the doctor who's doing the primary excision surgery. And it's important they work alongside each other so that, the expert in excision can point out, where to look, where to remove to these other team members.
Mm-hmm. And I know, what was the process like for you traveling out of state to see an expert?
It was, it was a little daunting, but fortunately I did have my sister to kind of guide me. So somewhere like the Center for Endometriosis Care, they make it pretty seamless. They have a list of, this is the process and this is where you're going to stay. It was definitely terrifying though. There's a lot that goes along, not only just flying, but I'm going to have surgery and then I'm going to fly home and how is this going to work? So it was pretty nerve-wracking. I relied heavily on my therapist at the time. I really relied on her to kind of give me tips and tricks. She was like a 4-time cancer survivor.
Wow.
So she knew all the tips and tricks for traveling for expert care. And so, I just made sure to stay on top of it, get a hold of the airline to see what kind of accommodations they made for the individuals traveling for surgery. I made sure that I found a hotel that had, a kitchenette in it and a separate living room from the bedroom, which actually, they're not significantly more expensive by any means. And often you can talk to these hotels to see if they have discounts for individuals traveling for healthcare. And so I made sure to have that so I could have some kind of feeling of normalcy while I was there. But other than that, it was definitely important to have someone there with me for transportation to drive me. And I stayed in the hospital overnight so they could monitor me. Once everything was fine, I was released, but they wanted me to stay in town for 48 more hours so that I could have a pre-op appointment before being released to go home. I did not have to have the cardiothoracic surgery portion done. Many individuals who do go to Atlanta for care end up with that surgery, and I know they're there for a much longer amount of time. So mine was pretty quick. I was only there for 3 or 4 days, and then I flew home. But I made sure to have, flight accommodations, and I wore, support, and I was just very, very slow with the process.
Yeah. Then you had to go back 6 months later for a second surgery. What happened there?
So I like this part because I do and I don't. So I did have to go back because we had done a partial hysterectomy to leave my cervix because it appeared normal. This is a very important part of the story because with adenomyosis, it can continue to cause pain if you leave the cervix. I didn't know the cervix was just the lower portion of the uterus. So I was still having, quote, mini periods. I was still having cramping, and I was having horrible ovarian pain as well on the right side. So I did have to go back and have another surgery. I did end up having my right ovary removed. We just couldn't seem to salvage it. It did have an endometrioma on it originally, and we had my cervix removed as well. But my favorite part about that surgery was 6 months later, I did not have any endometriosis when he went back the second time and looked around.
Wow. You've been through quite a bit. What inspired you to become a board certified patient advocate and co-run a social media platform for awareness and education?
A couple years into my recovery, I was just, I was looking back and thinking this is absolutely insane. And people are reaching out to me often on Facebook saying, I know you've gone through this. Can you talk to so-and-so about your journey? They're suffering. I said, of course. I was actually connected with my co-host of our platform, Laura, through a mutual friend on Facebook, and she was going to the same surgeon as me, so I helped guide her through that process, and it was very natural. And at that point, I was like, I really enjoy doing this. It feels good. And I, I reached out to her one day and I said, hey, would you like to do a blog and share our stories? Maybe no one will ever read it, but it's therapeutic, it's cathartic for us with our journeys. And she said, yeah, we'll do it. And then it definitely grew into something more than I ever thought. And I wanted to be I wanted to be like, how can I truly be the right type of patient advocate? So I just started doing research into what kind of credentialing was out there. And I found that there is this board certification. I went ahead and I studied, I took the exam. I've learned a lot about our healthcare system and how to be a true advocate. I used to think it was just speaking out and it was just sharing information, but I've learned since then that it's truly actually based on the patient. It's listening to the patient. It's presenting all options to the patient, not telling them what I think they should do. It's about just making sure they're making that informed decision and helping guide them to empower them to make the right choices for themselves and not me tell them.
Yeah. That's just, it's so needed having somebody like you that can just spread the information and create awareness around this. What did the recovery process look for you, like mentally, physically, and spiritually?
It's been a combination of so many different things. So my sobriety is a very important part of it. My sobriety has taught me not only how to address, the alcoholism, but working in recovery has taught me how to address my traumas. So that's a big factor in being able to recover from, the trauma of endometriosis, being able to forgive those who've wronged me, being able to forgive my body. I work with a therapist as well. I love cognitive behavioral therapy. It helps a lot with my unfounded thoughts that I've developed over time about myself and being crazy and what we call, the popular term now, gaslighting, gaslighting
Right.
myself. And physically, it's been a long journey of learning to love my body now. It will never be the same, and that is okay.
Yeah.
I can do more these days than I ever thought I'd be able to do. My body does not look the way that it used to look. And that is okay. My body is doing the best it can today for me. And I try to, reciprocate that by meditating when I can, and trying to give it the proper nutrition. I try to care for my body the best I can, essentially today. And I definitely overindulge quite often with desserts because I could not eat them for so many years. So now there are times I take advantage of my new gastrointestinal tract.
Oh, that's good. That's so healing when you haven't been able to do that for so many years, and you only live once, at least in this body. So you might as well enjoy it when you can.
I try. I definitely do try, but the spiritual part has been incredibly important for me. Otherwise, I'd be angry still. And I do think, on a very personal level, I think without the spiritual or emotional healing, I think my body would still be in a pretty constant state of stress and tension. It's really, really important for me to have the moments where I can relax and really let go of what has happened to me in the past.
Mm-hmm. So for all the listeners out there that are recognizing themselves and wondering if they also have been misdiagnosed and they do have endometriosis, how can they follow you and learn more from your experience? What social media platforms are you on that they could, tag along and learn more about this?
Yeah, so we're probably the most active on Instagram. We are Endo Girls Blog. Laura referring to Endo Girls being me and Laura and me. And we are also active on Facebook as well. We share the same posts that are on Instagram onto our Facebook, also Endo Girls Blog. And we are on Twitter as blog_Endo, where we try to share more just facts on that platform. We are always available. Our direct messages are always full. And we actually love that because we've made some amazing interpersonal relationships with those in the community. And it's not just it's not just saying, oh, here are the facts, see you later. We're a very tight-knit community. And we do have endogirlsblog.com for some more thorough, dense reading if anyone is in the mood. But otherwise, we try to keep it pretty broken down and easy to process information on our social media accounts.
That's just fantastic. I want everybody to go check you out and go follow her on Instagram and Facebook and all those platforms and learn more about it. Educate yourselves, because many times the doctors you're dealing with might not be aware. It is something that needs to catch up in medical school, the education on endometriosis. So go check her out and follow her and learn about this disease. And I want to thank you so much, Kate, for spending time with us today and educate us all on endometriosis and adenomyosis. It's been a pleasure to have you here.
Thank you so much. Thank you.
I hope you enjoyed listening to this episode of Dr. Lotte, Science with Soul. Make sure you are subscribed so you will be notified of new episodes as they become available. To book a session with me or to sign up for a workshop or to see me as a physician, please visit drlotte.com or divinespiritualessence.com. My book, Med School After Menopause, The Journey of My Soul, is available online at Amazon as well as other online platforms worldwide.